Hey guys, Martin here with Tree of Light Health. I hope you're having a great summer. I just wanted to pass along some information to you guys about gut health and wanted to share with you some of the latest thoughts and insights by some of the industry leaders. So I just wanted to maybe share my screen here a little bit and go over some of these things with you. Now, some of you have heard of leaky gut syndrome. It is a big time hidden cause of inflammation that we see out there. Some of you, unfortunately, are dealing with some pretty severe gut issues, such as small intestinal bacterial overgrowth, irritable bowel syndrome. So there is something here for you if you've been dealing with that. And if you're new to all this, this will also be a helpful discussion. Also, what we're finding out more and more is that there are people out there, including myself, with no gut symptoms that have distant, unrelated distant sort of indirectly related symptoms, such as skin problems, eczema, autoimmune disease, headaches, or depression, anxiety. So we can get into that. Again, if you don't know me, I'm Martin Van Leer. I'm the owner and founder of Tree of Light Health in Decatur, Georgia. We practice integrative, functional, and holistic medicine and tend to deal with complex chronic illness as well as health optimization. So I had the great pleasure of meeting Dr. Kiran Krishnan. He's the co-founder of Microbiome Labs. Wonderful discussion, and I just thought I'd share with you some of his slides and information that he passed along. I know that some of you are taking his products. His presentation was very long. It was about 2+ hours and 50 some odd slides. So I'd just like to condense some of that for you because I know that attention span may not be for 2 hours. Just some disclosures. I am a distributor of the Microbiome Labs products. I'm also a distributor of Synergy Science products. Just a quick disclaimer, none of this is meant to treat, cure, prevent, or diagnose any disease or ailment, nor is it to facilitate self-treatment. Anything contained in this webinar shouldn't be used as a substitute for professional advice of any kind. No nutritional supplement should be used to replace standard medical care. And of course, nutritional supplements are generally not approved by the FDA, though they are regulated. Always consult with your doctor before doing anything with your health. So first of all, before we take a look at the gut, we should know that, or we should understand what the intestinal lining is all about. That's our one-layer cell thick, which is not very thick. That covers a surface area about 2 tennis ball courts and surface area. So that's a pretty huge area. It takes up about 40% of the body's energy expenditure. And if you consider the brain also takes up about 20% of the body's energy expenditure, 60% is between gut and brain. So that's a huge amount. Of course, it prevents loss of water and electrolytes. It protects us from the outside environment. Many of you may not know that 90% of the serotonin is made in the gut. And so if you're dealing with depression, anxiety, and maybe taking an SSRI or maybe taking some herbal supplements and you have not yet looked at gut health, I would strongly advise you do that because if you work on the gut health, then that can definitely help some of the neurological symptoms. And of course, the gut is a huge site for lymphatics and venous return. Here's just a quick electron micrograph picture of, the gut and what we're talking about here. This green line here is that one cell thick of the gut lining. And then you notice to the left is all this area teeming with bacteria, food particles, toxins. And then on the right, just one cell away, is our immune system, our red blood cells, and the macrophages and lymphocytes. Also very interesting how much light is generated by all of these cells and tissues. So maybe that's a biophysics discussion for some other time. So in a healthy gut, what do we have? And this is what we want. We want this diversity and protective strains out here. in the periphery. And then in the blue, we want this nice mucosal lining. That's almost like a slime coating on the cells here that protect them, okay? And then the cells themselves have very nice tight junctions. But with unfortunately with the leaky gut, and again, you don't even have to have symptoms of gut issues to have leaky gut. In fact, it's thought that many of us have some form of leaky gut or are on some continuum of that. I'll show you my case here in a second. But in the leaky gut scenario, we have dysbiosis. What does that mean? That means there's an overgrowth of some bacteria that should not be there. Generally, that's gram-negative bacteria such as E. coli and Klebsiella. And when they overgrow, they create these toxins, and that can get into the system here. This blue area here is the disrupted mucosa. So as a result of the low diversity, low keystone strains such as Akkermansia, Bifidolongum, and others, they're not able to be the policeman and protect this mucosal lining. And this disrupts the mucosal defense, and then leads to these breakages here in these cells, otherwise known as leaky gut. So food particles come in, toxins come in, and the body recognizes this as foreign, and this activates the immune system and leads to inflammation. So the classic thing that can happen here is gluten, which is a food particle from wheat that can, of course, we all consume that unless you're completely gluten-free, such as myself. That can come in and really trigger autoimmune thyroiditis. So by all means, if you have a problem with your thyroid, whether hypo, hyper, or autoimmune thyroiditis, I would strongly urge you to take a look at gluten and see if removing that helps your symptoms. The other issue here is that the gram-negative bacteria release something called LPS. So you can see here, lipopolysaccharide. And this is a lipid-based toxin that the bacteria produce. We all produce lipopolysaccharide, but too much of it can really, really activate the immune system. So you can see here, LPS is docked onto this big blue blob here. That is a macrophage, and that's not a good thing. And that really activates interleukin-6, TNF-alpha, and this whole inflammatory cascade. So again, all of us are on some continuum, unfortunately, due to toxins, due to issues like glyphosate, which is a very ubiquitous toxin in the environment, due to food allergies and alcohol and many other things, leading to leaky gut. All of this increases LPS, or lipopolysaccharide, leading to inflammation. So this can affect the heart, it can affect the immune system, it can affect the liver, the brain, the lungs. It can cause metabolic disorders such as diabetes, and metabolic syndrome, which is now on an exponential rise in the United States, leading to the obesity epidemic. Thyroid, as I just mentioned, in terms of hypothyroidism or autoimmune thyroiditis. Joint pain. Think about joint pains that are coming, that are, that you don't know where they're coming from. They're very subtle. If I eat gluten, I will notice some joint pain just about a few days after I eat that wheat or gluten. By the way, this is from Cyrex Labs. We can look at the intestinal permeability of the gut lining. Metabolic syndrome, like I just said, one of the biggest killers in the United States is heart disease. This is also related to hypertension and high cholesterol, blood sugar dysregulation, and it can lead to many, many diseases. So this one toxin, this lipopolysaccharide, can lead to all of these things. Lipopolysaccharide is also known as endotoxemia. And so this article goes very deep into how that exactly causes diabetes. So the conclusion here is that postprandial endotoxemia, in other words, after you eat, we have this rise, all of us do, of lipopolysaccharide. What I learned from Kieran is that this happens about 4 to 5 hours after we eat. And if we have a leaky gut, this can really, really affect things. And in this case, lead to obesity, lead to insulin resistance, and unfortunately diabetes in many. So again, peaking 4 to 5 hours after we eat, not good. We need to figure out how to fix our leaky guts, even if we do not have symptoms, because this is causing all of the chronic illnesses that we are seeing here today. The integrity of our gut, again, determines how much damage from LPS we might receive. We really, all of us, need to work on microbial diversity, including the keystone species that protect us from this very harmful lipopolysaccharide. We'll talk about short-chain fatty acids. Ultimately, they come from fibers. Fibers produce a substance called butyrate, which is wonderful to support that protective mucus layer, and really, really important. Unfortunately, some of you cannot tolerate fibers, so we need to talk to you about how to boost short-chain fatty acids. This is an article that discusses how the gut microbiome may affect Parkinson's. Unfortunately, we have long known that Parkinson's may be a result of an interruption in the gut lining. These endotoxins, such as lipopolysaccharide, can lead to something called alpha-synuclein, which is an agglomeration of proteins, kind of like a ball, and that can get into the nerve cells and prevent them from functioning properly. All of this happens through the vagus nerve. So again, if you're dealing with some sort of neurological issue, whether that is depression, anxiety, insomnia, Parkinson's, Alzheimer's, memory trouble, headaches, please do look at gut health. So what are the symptoms of leaky gut? Well, you can have a burning in your upper GI tract, such as we see with gastrointestinal reflux disease or GERD. You can have painful digestion or indigestion. Diarrhea is very common. Gas and bloating, which we see from an overgrowth of bacteria in the small intestine. That's called small intestinal bacterial overgrowth, which we can actually test for and treat. Fatigue, just simple fatigue. Brain fog, and of course I would probably throw in there, like I mentioned earlier, skin issues, joint issues, thyroid issues, autoimmune issues. We mentioned this whole gut-brain connection. Well, there's also a thing called mitochondria, which are all the power packets of all our trillions of cells. Well, guess what? If you have a leaky gut and that lipopolysaccharide is increasing, that's really going to create its whole inflammatory state, as we mentioned. Well, the mitochondria that are our batteries for all our trillions of cells also become leaky. This sets up a whole thing called the cell danger response. This, by the way, is a theory of chronic illness introduced to us by the wonderful Dr. Robert Navio, who's an MD, PhD, and has done wonderful, wonderful research. But in the state of cell danger response, the body thinks it's under threat, so everything shuts down. You may get stuck into what we call a hibernation mode, and we think this is one of the main causes for chronic fatigue syndrome. The key is what do we need to do to get the body to think that it's not threatened? Well, in the case of leaky gut, we need to fix that. If you have small intestinal overgrowth, we need to fix that. If you have mold or Lyme, we need to remove that first before the body can pull out of cell danger mode. Some of the main causes of leaky gut syndrome is antibiotics. Those are very, very disturbing to the microbial diversity and disrupt that mucus lining and lead to leaky gut, as we mentioned. Stress is a big one. That will divert blood flow from the gut to the skeletal and heart muscles to, I guess, run from the proverbial tiger, as we say, but you're not going to digest food very well in that setting. And more and more, we're seeing chronic stress as a driver for many chronic illnesses. Diet, processed foods, not good, creating lots of inflammation in the gut. Low fiber creates this deficit in short-chain fatty acids and therefore reduced microbial diversity. Way too much sugar in our diets, way too much, causing yeast, which is very damaging to the gut. Pathogens, as I mentioned, we will probably throw parasites in there that can cause a problem. Gluten, as we mentioned, a big gut disruptor leading to leaky gut. SIBO, as we mentioned, medications is a big one. Aspirin and ibuprofen alone, it can create lots of problems with inflammation in the gut and lead to leaky gut syndrome. Toxins, glyphosate is pretty much ubiquitous in all of our water supply. If you are not filtering your water, ideally through reverse osmosis or through a technology that we have with Clearly Filtered, which is a wonderful company, then you could be really getting exposed to this. We can actually measure and treat and help you remove glyphosate, which will in turn help with improving gut health. Alcohol, very socially accepted, but very damaging to the gut lining, leading to acid reflux, leading to candida and bacterial and fungal overgrowth. Mold is a big one. Mycotoxins, very damaging to the gut lining. So if you're dealing with mold but not dealing with leaky gut syndrome, then that could be a problem. So antibiotics has really fueled the epidemic of gut problems. And this is a wonderful book by Dr. Blosser, who's a wonderful MD, and really goes into deep discussion here about how all the antibiotics that we have been exposed to really have caused the epidemic of anxiety and depression by disrupting the microbes in our guts. We're seeing an explosion of C. diff, not only in the hospitals, but now in the community. One course of antibiotics can alter the microbial diversity by up to 30 to 80%, sometimes for life, which is not good at all. In fact, in our practice, the more antibiotic use we see in early life, the more resultant gut problems, autoimmune issues, and chronic illness, period. So we need to work on restoring that microbial diversity. Dr. Blosser really talks about how the mild or a small amount or trace amounts of antibiotics that get into our food supply, especially into the meats that, they use antibiotics to beef up animals before slaughter. And this same effect happens with us. When we get antibiotics, we will actually put on weight through a biochemical mechanism. So associated conditions, gluten sensitivity and celiac, food allergies, irritable bowel syndrome, multiple autoimmune diseases, and some of the other things that we mentioned, neurological and depression, anxiety. One way to look at this leaky gut issue is through the Cyrex test. So this is actually me, believe it or not. I was having some issues with some skin rashes, as I mentioned, and I was noticing some low B12, low energy, low iron. So I wanted to take a look at gut health. Well, you can see that I have a immunoglobulin M, or IgM, which is elevated for zonulin. That means my body was not liking this, and the gluten at least, and I had a pretty high wheat Zoomer score, and then a pretty decent elevated intestinal permeability score. And we can get more advanced data, of course, looking at all of the types of the proteins in wheat and gluten, such as gliadin, which can be problematic. And the wheat Zoomer test is a wonderful test I guarantee you that if you don't think you have a wheat or gluten problem, if we run this test, we can probably find it. In my case, as I mentioned, is creating a rash. It's called dermatitis hepatiformis. And sure enough, unless I'm doing like low dose immunotherapy or working on gut health, I will get this just from faint amounts of wheat or gluten introduced into my system. And I have not really received a lot of antibiotics in my life. Maybe I can count on one hand how many I've received. But again, this is a problem, a hidden problem in many of us. We can also use functional stool analysis, such as the GI effects. We can look at, this is sort of their dashboard. We can look at levels of maldigestion, which is huge for many, not digesting their lipids, proteins, or fats, or carbohydrates. We can look at the inflammation levels, the calprotectin levels, the secretory IgA, very important, the level of dysbiosis. We can look at if there's a deficit in short-chain fatty acids and infections, whether or not there's bacteria, yeast, or parasites. So very important test to run if you're dealing with gut issues. By the way, Microbiome Labs has a really advanced new test to assess the microbiome. So you may be wondering, well, how healthy is my microbiome? Well, this test will tell you through very advanced gene sequencing technology. So they give a nice dashboard here. They can kind of rate your gut microbiome index and tell you how healthy your gut microbiome is, how diverse it is. Remember, we want more diversity. AMR richness, pathogens, you give you a pathogen score, and then they'll tell you about these keystone species. Again, these are like the policemen that keep things at bay. And if it's too much overgrowth, the Akkermansia will keep it down. And if there's not enough good species, these types of keystone species will help to bring that around. So that's a great test. Do look at that. We have those here in the clinic if you're interested. So just how to treat all of this? Well, it seems sometimes overwhelming, but it could be as simple as just introducing some basic things. The Microbiome Labs has this reinforce, rebuild, and recondition the gut. That's basically a simplified version of the 5R program that we have used in functional medicine for gut health. Anyhow, basically want to reestablish the microbiome, introducing key postbiotics, short-chain fatty acids, good species, basically an advanced probiotic. I'm sorry, we're going to recondition the gut first with these things, then reinforce these changes with short-chain fatty acids, and then rebuild the mucosal lining. So what does that look like? That's basically the megaspore, which some of you have been taking. This is an advanced spore former probiotic. Okay, so probiotics do a lot, especially this one. It does not have to be refrigerated. Just some myths here. It will not create a monoculture. So if you take spores, it will not create a monoculture in your system. It will not create mast cell issues. So if some of you have histamine and mast cell issues, megaspore will generally not do that. However, if you introduce it too quickly or even with the wrong strain, in fact, in some cases, we don't recommend megaspore at first for some very sensitive patients. They have other strains such as HU58, which we would introduce first. Spores are very, very important. In fact, none of us are walking around barefoot anymore, working in our gardens, getting the natural spores from the environment, or at least very few of us. So therefore, the need for probiotics these days is increasing. You can boost the effectiveness of the megaspore biotic by a factor of 10 with mega prebiotic. These are certain sugars and other things that really boost the megaspore, sometimes, like I said, by a factor of 10. And then rebuilding the mucosal lining with immunoglobulins, as well as certain proteins such as proline. The studies that Microbiome Labs has been pretty incredible, and I've become more and more impressed. In fact, I wasn't a big fan of probiotics for quite a while until Microbiome Labs really started to roll out the studies. And here's just one published in the World Journal of Gastrointestinal Pathophysiology, basically talking about how megaspore greatly reduces this after eating dietary endotoxin, again, the lipopolysaccharide, reducing that. It is creating so much of this inflammation that we're seeing. Triglycerides, which are not good for our vascular and arterial health, and reduces many other disease biomarkers. So do check that study out. They have many studies now, which we can share with you. This is another study that Microbiome Labs had done with the University of North Texas, double-blind, placebo-controlled study. Here on the right, these did not, this group here did not get the probiotics. On the left, they did, and they measured them 3 to 5 hours after, as well as 30 days after the introduction of the probiotics, and they're seeing great improvements in endotoxin, triglycerides, ghrelin, which is the hunger hormone, inflammatory markers, glucose, insulin. And so again, here on the right is all the red and pink, and that's kind of what you don't want. But after 30 days, boy, we're with a spore-based probiotic like Megaspore, we're seeing a great deal of improvement. So just think about just taking one pill, maybe once or twice a day, can have that dramatic of an effect to reduce inflammation. And I guarantee you that if you're working with us and you're a patient of ours and you're not addressing gut health or addressing this, we please do talk to us, because we need to address this inflammation. 5R program I sort of briefly mentioned earlier. In general, we want to remove the food allergens, alcohol, mold exposure, sugars. We want to clean up the diet. We want to treat with herbals, and we use that. For example, if there is H. pylori detected, there's Microbiome Labs has another supplement called Pylogard, which actually surrounds the H. pylori and renders it inactive. In some cases, we need to use medicines like Xifaxan, which is an antibiotic that has been very effective in removing some of the overgrowth and other problems in the gut. That requires a prescription. And then we replace with enzymes, nutrients, and probiotics. We want to re-inoculate the gut. We want to repair the gut with a good mucosal lining product like Mega Mucosa. And then we need to rebalance, work on diet, lifestyle, and stress, because that's so important for gut health. As we mentioned, there's 4 key products here: the Megaspore, the Mega Pre, and the Mega Mucosa. Megaspore can actually bind to lipopolysaccharide, really increase this diversity, help the keystone species, and help produce short-chain fatty acids. The Mega Pre will really boost that effect, like we said, up to a factor of 10. The Mega Mucosa helping that stomach lining. One thing that some of you are on is Mega IgG, which is very helpful. These are immunoglobulins that actually bind to LPS and food toxins, and this reduces inflammation in the gut and food allergies. A little bit more here on Mega IgG. In fact, they just came out with a powder, so if you're taking pills with this, the powder is much more effective and can give you higher dosing. But here on the left, we have mucosal activation. Do you see these little gaps here in between these cells? That's the lipopolysaccharide and the lack of diversity. Well, if we add in an immunoglobulin like the Mega IgG, it can bind to these toxins and keep them from damaging the mucosal lining. You will not have to be on it forever. As we heal the gut, we can remove this one. I will say overall, guys, that this is a bit of an art working with the gut health, not only in terms of testing and assessment, but also treatment. So please do work with a practitioner. Don't just start Megaspore if you have major gut issues. These things have to be introduced in some cases very gently and methodically over time. Please do work with someone. Other helpful interventions, as always, please avoid antibiotics if you can. Please don't drink chlorinated water. That makes the gut issues worse. Eat organic to avoid glyphosate. You want to increase your fiber. Now, if you're dealing with small intestinal bacterial overgrowth, probably not going to work for you unless you're working with us with specific fibers there. In general, we all of us need to increase our fruit and vegetable intake by 9 per day and 35 per week. So if you think back on your diet for last week, how many different fruits and vegetables did you actually take in? If it's under this amount, you may not be getting the genetic diversity or the biological microbial diversity that you should be getting in. Polyphenols such as berries are very helpful. How do we increase or heal the intestinal lining? We do that with glutathione, glycine, and glutamate. Not everyone can tolerate that. Some are very sensitive. Bone broth is very helpful, but that can lead to histamine and MCAS symptoms in some people. Colostrum, very helpful, but some can't tolerate, so we need to evaluate. Fatty acids such as omega-3s, very helpful in general. That will lower lipopolysaccharide. And then there is a thing called specialized pro-resolving mediators, which are a subfraction of the fish oils. They're very anti-inflammatory and great for gut health. Phosphatidylcholine, and adrenal support. If the adrenals are really lacking in a chronic stress situation and you have gut issues, that also needs to be addressed. We test for food allergies and treat with something called low-dose immunotherapy, which has been a huge game changer in terms of helping reduce the food allergy piece of this, because that alone is very complex. To boost short-chain fatty acids, sometimes we add butyrate. There's all kinds of butyrate out there. We could almost do an entire webinar just on butyrate, but just know that there's one that we really like called Tributyrin X, which is much more stable and more powerful. Again, that's boosting short-chain fatty acids to build the mucus layer, and that protects our gut and helps it to heal. For some of you who cannot tolerate butyrate or anything oral, we can do suppositories and enemas, but those require a prescription. Humic and fulvic acids are also very helpful. We work with some companies that have great products on that. Here's just a quick article on the potential benefits of butyrate in the intestinal diseases. So again, if you have an intestinal issue, irritable bowel syndrome or whatnot, please do ask us about butyrate and how we can help you with that. Peptide therapy has been a wonderful addition to helping to heal the gut. What are peptides? They're basically amino acids that act as chemical messengers, generally under about 50 amino acid sequence. Body protective compound, or BPC 157, has been a great addition to healing the gut. It treats leaky gut, food intolerances, irritable bowel. I want to say treat, it supports. Yes, it supports leaky gut, food intolerances, and irritable bowel syndrome. Helps with gut infections, reduces inflammation. So if you have a gut issue, please do ask us about BPC 157, now available in oral form. Thymosin beta 4, we actually use a fragment of that, which is even more powerful and does not have the mast cell activation part of it. Acts as an immune modulator, anti-inflammatory. Really does help to repair these tight junctions in the gut, and very, very great in that regard. Has some other great benefits in terms of anti-fibrotic qualities, helps to prevent hypercoagulability, which we see often in chronic illness, and can really break up biofilm. So do consider peptides. There's more here, but in this regard. KPV is another one to reduce inflammation, so do ask us about those if you're not already taking. Hydrogen water has been shown more and more to really be a very potent antioxidant. So remember, part of what's causing a lot of the leaky gut issues is this inflammation secondary to food allergies, secondary to lipopolysaccharide, secondary to dysbiosis. So to heal the gut quicker, we do like hydrogen water, because you can simply, we all need water, and water we can drink it throughout the day to help heal the gut, okay? And it also has many other peripheral benefits, such as boosting mitochondria and improving metabolic syndrome and athletic performance. So where to start with all this? Well, again, we would suggest working with a practitioner, because unfortunately these things are rather complex. We do functional testing, as we mentioned, such as functional stool analysis and testing for some of the overgrowths of bacteria. Unfortunately, many of you have already done that testing and still are struggling. So given the complexities of the body, we are trained in something called advanced biofeedback or autonomic response technique, as well as field control therapy and others. In this way, we can sort of figure out a deeper layer of problems in the body that could be leading to some chronic health conditions. We have information on our website about autonomic response testing, so do take a look at that. To learn more about leaky gut and some of these issues, and especially how it relates to autoimmunity, food allergies, do take a look at the Keystone Approach by Rebecca Fett. This is a wonderful book, especially if you're dealing with any kind of arthritic pain conditions or food allergies or autoimmune disease. She really emphasizes the Mediterranean diet, which has been, shown to be very helpful, but also a low-carb version of that. So please do work with a nutritionist on that. And not everybody, of course, can tolerate that diet. There's many diets, by the way, that we look at when healing the gut. Everything from low FODMAP to keto style diets to GAPS diet, which is a very important diet. This diet was introduced by Dr. Natasha McBride. Some of you have tried that. It's basically very, very gut healing and heal the gut, but rather challenging for some people, especially in the summertime, as it involves meat stocks, which are very healing for the gut, but some of the vegetarians out there and vegans can't do that one as well. And also, I mentioned Fiber Fueled earlier by Dr. I can't pronounce his name. I just say Dr. B. But he's a wonderful gastroenterologist and really talks about the importance of fibers. Again, be very careful with fibers. There's certain specialized fibers that need to be introduced first if you're having gut inflammation and gastroenterological GI symptoms. If you're not having GI symptoms, you definitely want to increase your fiber, and we can help you with that. In general, we want to go increase our biodiversity, as we mentioned, over 35 fruits and vegetables a week, different varieties. This is a local farmers market, which we really do like, and you can get to know the farmers, and you can see all the different types of colors there, which really do help in terms of gut health and health overall. Get a dog, get dirty. Well, most of us have become so sanitized since COVID that we're afraid to get dirty. Well, the dirt is actually where all of the microbes live and hide out and communicate. And believe it or not, that can actually help our microbial diversity. So this is my dog, Kasha, and boy, she really gets dirty, and she eats feces. She rolls around in the mud. The nastier, the better. But what I think she's trying to do is introduce these things into her microbiome to strengthen it, should she get sick. Because remember, she doesn't really take supplements or medicines like we do, and she is super healthy and really, really amazing to watch how she goes throughout the day, eating grass and leaves and other things. Anyhow, if you're struggling with gut issues, please know that there is hope. No matter how bad it is, we've had patients in extraordinarily dire situations, huge swollen guts, small intestinal bacterial overgrowth, where they feel and look pregnant. It just takes time and a lot of persistence. Remember, the gut healing replaces itself every 3 days. So just think about that. Now, that may tempt you to want to fast, and in many cases, that's good. But for some of you with adrenal compromise and energy issues and blood sugar issues, that may not be the best thing to do. So please do work with someone on that. Look at peptides. If you're not using peptides, a wonderful treatment. And the pricing is coming down. There is a wonderful one to actually bind the zonulin, which is involved in leaky gut syndrome, called liraglutide, and that's in the phase 3 clinical trial. This knowledge that about the microbiome will just keep expanding. Karen was telling us about the laboratories now all around the world working on this problem, trying to come up with certain probiotic species that will help with gut healing. So we'll keep you apprised of that as we learn more. By the way, if you want to try some of the Microbiome Labs products, we have those here in the clinic. I can send you a purchase link. It's called Let's Get Better. And then for the hydrogen water, there's a code too for that. That'll give you maybe a little discount there. Anyway, thank you so much. Here are some of our references. We have many, many studies that we just couldn't cram in here, but hope you found this helpful, and wishing you all the best with gut health. Please reach out to us if you have any questions, and hope to talk to you guys some more later this summer and into the early fall about many, many things that are on the agenda that we'd love to talk to you about, especially COVID and Omicron, some of the latest developments there, some of the latest developments with mold and Lyme, and peptides, of course, and genetics, and many, many other things. So stay tuned and be well, and we'll talk soon. Take care.